Hello everyone, sorry I couldn't be there, but I do wish everyone the best with their presentation. I read chlamydia, and chlamydia is a common sexually transmitted disease caused by the bacteria Chlamydia trachomatis. Chlamydia trachomatis is a bacteria, but it is known as a unique bacteria because it doesn't possess all the characteristics of a normal bacteria. It's small and difficult to isolate, and it's a gram-negative cell. It has a gram-negative cell, such as rickettsia. Chlamydia is the most frequently reported bacterial sexually transmitted infection in the United States. In 2011, 1,412,791 cases of chlamydia were reported to the CDC from all 50 states and the District of Columbia, but an estimated 2.86 million infected occur annually. It has such a large number versus the ones that were actually reported because of the symptoms are so silent and you don't know you have it. And they don't get tested for it or no treatment occurs because they don't even know they have it. Chlamydia is most common among young people, ages 14 to 19. It is estimated that 1 in 15 sexually active females, 14 to 19, have chlamydia. Chlamydia can affect both men and women and cause serious permanent damage to a woman's reproductive system. Chlamydia is known as the silent infection because most infected people have no symptoms. If symptoms do occur, they may appear until several weeks later. Even when it causes no symptoms, chlamydia can damage a woman's reproductive system before she even realizes that she actually does have chlamydia. Signs and symptoms of chlamydia include painful urination, lower abdominal pain, painful sex, and vaginal discharge. The bacteria first infect the cervix and the urethra. Some infected women have a normal vaginal discharge or a burning sensation when urinating. Untreated infections can spread upward to the uterus and fallopian tube, causing pelvic inflammatory disease, and it can lead to infertility. You can get chlamydia through sexual activity. It is a venereal disease. Semen from the penis, vaginal fluid, and blood can carry the bacteria that causes chlamydia. The bacteria can enter the body of a person through contact with these fluids in different areas. Risk factors. People that are under 24, sexually active, that people that have multiple sex partners, no or infrequent uses of condoms, history of prior sexual transmitted diseases. If you have had previous STDs or STIs, you are more prone to having chlamydia. How long does it last is usually people's question. It can last for a very long time when it's untreated and can be very dangerous. It has no symptoms for a long time in some people, and you may not even feel anything if you have chlamydia, and so you can't tell if you have this and get treated. It can just come and go. You can have symptoms and it go away and you think it's just gone and it was just a bacterial infection like a yeast infection instead of chlamydia. Those who don't notice that they have this infection will feel something for weeks to months, depending on how severe the infection is. For pregnant mothers, chlamydia can be very dangerous. It can cause ectopic pregnancy, or at least your risk for ectopic pregnancy is high. And the ectopic pregnancy is pregnancy in the uterus but happens somewhere else. Well, ectopic pregnancy is when it's supposed to be in your uterus, but it goes somewhere else like the fallopian tube and somewhere else, not where it's supposed to be. How is it treated? in the mother is treated the same way as it would be treated in another person. People can say it can harm the baby, the medicine, but either way, the baby may have a chance of being harmed. The baby, when it's come out the birth canal, it has the risk of having severe eye infection, or it can even cause blindness or respiratory system problems and cause pneumonia. The child may have the chlamydia itself. Some chlamydia infections the infant may get can be treated with antibiotics. Chlamydia can be in your body for a very long time unless there is a use of antibiotics. A 7 to 10 day treatment with antibiotics is required, or at least suggested by the doctor. Tetracycline is one of the most common antibiotics used to treat chlamydia, but not everyone can take this antibiotic in case you're allergic or have other issues. Erythromycin is another drug that is used. The doctor will prescribe according to your medical history and if you have any allergic reactions in the past. Long term, and if not treated, it may result in infertility, which is the inability to have children, pelvic inflammatory disease, known as PID, may be another result of untreated chlamydia, causing severe inflammation and scarring of the fallopian tube and the lining of the uterus. Research shows that 50% of all cases of PID are a result of chlamydia infection. Mothers that come into the office for their first prenatal visit do get tested for chlamydia because it can be very dangerous and it's very treatable if caught in time. So this was my presentation. I hope everyone has a good day. I'll see you guys soon. Bye.